Good afternoon, everybody. We are here today to discuss about local delivery mechanism, Arestin. You will find this interesting because through this presentation, we are going to find out whether Arestin is really effective in reducing pocket depth in patients with periodontitis. Through this presentation, we will talk you about some fun facts about Arestin, availability, mechanism of action, indications, advantages, patient instructions after its administration, adverse reactions, and also the scientific evidences which support the effectiveness of Arestin in controlling periodontitis. What is Arestin? So, Arestin is a locally applied antibiotic which is placed directly into the infected periodontal pocket at the time of SRP, that means scaling and root planning. So it is a unique delivery system where the minocycline microspheres are administered as a powder to allow for easy targeted placement at the base of periodontal pockets. Arestin and scaling and root planning fights the harmful bacteria deeper and longer than the SRP alone. Commercial availability. Arestin is available as 1 milligram minocycline powder, which are incorporated into a bioresorbable polymer or PGLA for professional subgingival administration. They are produced by Oro Pharma. Patients qualify for prescription coverage through their medical benefits. They are only available through prescription and there can be 12 cartridges in a box. Mechanism of action. As per FDA, the mechanism of action of Arestin is unknown, but microbiologically, it belongs to tetracycline class of antibiotics with a broad spectrum of activity and also bacteriostatic. That means it prevents the multiplying of bacteria. As we can see in the picture, the scaling and root planing alone can only remove bacteria till the pocket depth of 5 mm. But when we combine with Arestin along with SRP, they both can remove the bacteria from probing depth of almost 5 to 9 within 5 to 9 mm.
Approximately 10 million to 1 billion bacteria have been observed in the periodontal pocket. These bacteria reside within complex biofilms that are resistant to the body's natural defenses. Even after professional care, such as scaling and root planing, the bacteria in biofilms can remain in the periodontal pocket and continue to replicate. Arestin, minocycline hydrochloride microspheres, 1 milligram, is delivered as a yellow powder in a single-dose site-specific cartridge, which allows for easy placement directly to the base of the periodontal pocket. Once Arestin is inserted, it immediately adheres to the periodontal pocket and tooth surface where the pathogens associated with periodontal disease reside. Gingival crevicular fluid slowly breaks down the polymer, causing water-filled channels to form inside the microspheres. These channels provide escape routes for the sustained release of the encapsulated antibiotic. The active drug diffuses out of the microspheres into the surrounding tissue, where it begins to eliminate the periodontal pathogens. The microspheres are then harmlessly absorbed into the gum tissue. Through this process, Arestin is able to maintain therapeutic drug concentrations of the active antibiotic minocycline for up to 21 days, continually eradicating periodontal bacteria.
Indication: as an adjunct to scaling and root planning procedure for reducing bleeding for deeper periodontal pockets, site which is unresponsive to scaling and root planning alone, for gaining cal by 0.5 to 2 mm, for periodontal maintenance program which includes good oral hygiene and root planning and scaling. Arestin was administered to periodontal pockets which would be greater than 5 or equal to 5 mm in the adjunct therapy groups at baseline 3 months and 6 months. Contraindications. Arestin is contraindicated in any patient who has known sensitivity to minocycline or tetracyclines. Hypersensitivity reactions and hypersensitivity syndrome that include were not limited to anaphylaxis, anaphylactoid reaction, and angioneurotic edema, urticaria, rash, eosinophilia, and one or more of the following hepatitis, pneumonitis, nephritis, myocarditis, and pericarditis may be present. Swelling of the face, pruritus, fever, and lymphadenopathy have been reported with the use of Arestin. The safety and effectiveness of Arestin has not been established in immunocompromised patients or in those with coexistent oral candidiasis. Use with caution if there is a predisposition to oral candidiasis. Tetracycline, including oral minocycline, have been associated with development of autoimmune syndromes, including a lupus-like syndrome manifested by arthralgia, myalgia, rash, and swelling. Sporadic cases of serum sickness-like reaction have presented shortly after oral minocycline use, manifested by fever, rash, arthralgia, lymphadenopathy, and malaise. In symptomatic patients, diagnostic tests should be performed and Arestin treatment discontinued. The use of tetracycline class during tooth development may cause permanent discoloration of the teeth and therefore should not be used in children or in pregnant or nursing women. Advantages: when incorporated into a routine oral maintenance program along with SRP, targeted periodontal bacteria to fight infection at 1 month, provided significantly greater pocket depth reduction for up to 3 months versus SRP alone, resulted in reduced pocket depth after 1 month and maintained at 9 months. Disadvantages: without an antibiotic such as Arestin, baseline levels of bacteria may return in just a few days even after SRP. The effects of Arestin on microorganisms over growth have not been studied beyond 6 months.
Dosage and administration. Arestin is provided as a dry powder packaged in a unit dose cartridge with a deformable tip, which is inserted into a spring-loaded cartridge handle mechanism to administer the product. The disposable cartridge is removed from its pouch and connects the cartridge to the handle mechanism. Arestin is a variable dose product dependent on the size, shape, and number of pockets being treated. The administration of Arestin does not require local anesthesia. Professional subgingival administration is accomplished by inserting the unit dose cartridge to the base of the periodontal pocket and then pressing the thumb of the ring in the handle mechanism to expel the powder while gradually withdrawing the tip from the base of the pocket. Patient instructions. After treatment, clients should avoid chewing hard, crunchy, or sticky foods with the treated teeth for 1 week, as well as avoid touching treated areas. Postpone the use of interproximal cleaning devices around the treated sites for 10 days. Should be advised that although some mild to moderate sensitivity is expected during the first week after treatment, they should notify the dentist promptly if pain, swelling, or other problems occur. Should be notified to inform the dentist if itching, swelling, rash, papules, reddening, difficulty breathing, or other signs and symptoms of possible hypersensitivity occur. Precaution. Hypersensitivity reactions, autoimmune syndromes, for example, lupus-like syndrome manifested by arthralgia, myalgia, rash, and swelling, should be used with caution in patients having a history of predisposition to oral candidiasis, has not been clinically tested in immunocompromised patients, such as those immunocompromised by diabetes, chemotherapy, radiation therapy, or infection with HIV. Arestin has not been clinically tested in pregnant women and has teratogenic effects. Potential for serious adverse reactions in nursing infants from the tetracyclines as they are excreted in human milk. Should not be used in any patient who has known sensitivity to minocycline or tetracyclines.
So I'm going to discuss adverse reaction of Arestin. First is the oral candidiasis because it is the family of broad spectrum antibiotic tetracycline. It can also develop resistance of bacteria. Skin irritation, this may cause redness, itching and dryness on the skin. Photosensitivity in terms of it can cause sunlight sensitivity leading to a rash, redness or a burning sensation. Some GI problems such as nausea, vomiting and diarrhea. Allergy reaction, like it can rarely cause allergic reaction but which may include hives, difficulty breathing, swelling of the face, lips, tongue and throat. Dizziness and lightheadedness. This medication can also cause, like particularly when standing up, it can cause dizziness and lightheadedness. Tooth and bone problems such as the discoloration of tooth, staining as well as bone growth retardation in the children. If you experience any of these adverse reaction, contact your healthcare provider immediately. So here is the scientific evidence. Systemic review and meta-analysis published in the Journal of Periodontology in 2018 evaluated the efficacy of minocycline hydrochloride microsphere, which is Arestin, and local delivery of the treatment for the chronic periodontitis. So the review included 13 studies and concluded that minocycline hydrochloride microsphere local delivery was effective in specially reducing pocket depth and improving clinical attachment level compared to non-surgical periodontal therapy alone. So overall, studies provides that evidence for the efficacy of minocycline hydrochloride microsphere local delivery and the treatment of periodontitis. So scaling and root planning combined with this therapy is more effective than scaling and root planning done alone in reducing the probing depth and gaining a clinical attachment level in periodontitis clients. So as we discussed earlier, as well as image shown in here, that combining effect of Arestin and scaling and root planning is giving synergistic effect as compared to performing only non-surgical periodontal therapy such as scaling and root planning in periodontitis clients. By giving reducing pocket depth nearly 40% or more, removal of harmful bacteria by 2x and reducing bleeding by 2x. So overall it is very effective in periodontitis clients. So it is very small video of pocket depth before placement of Arestin and post-operative effect of Arestin in terms of pocket depth reduction.
At the initial appointment, a 5mm pocket was found on the mesial of 7, as you can see here with the probe. You can also see that the tissue is cyanotic, bleeding, and bulbous, which indicates infection. Periodontal therapy was performed with the ultrasonic and hand instrumentation, and then an antibiotic called Arestin was placed, given with strict home care instructions as well. Now at the 6-week reevaluation, we reprobe and find that there is no bleeding and an improved 4mm pocket.
To drawing the conclusion, based on the scientific evidence, using minocycline hydrochloride microsphere local delivery can be effective adjunct to non-surgical periodontal therapy for the treatment of chronic periodontitis. Studies have shown that minocycline hydrochloride microsphere can reduce pocket depth and improve clinical attachment level in patients with the periodontitis. However, it is very important to note that individuals' result may vary and treatment decision should be in a consultation with the dental professional. Additionally, it is important to consider that potential side effects and contraindications before using minocycline hydrochloride microsphere local delivery in periodontitis clients. Overall, minocycline hydrochloride microsphere local delivery can be very valuable treatment option for periodontitis client when used appropriately. Here are some of our references that we used for this scientific evidence-based research. Thank you.